All of you are aware of the disease called epilepsy. You are nursing students, you are aware. Unfortunately, epilepsy is a disease which can cause disability to patients if they are not treated at an early stage. The incidence of epilepsy is very high in Indian population. If we diagnose epilepsy at an early stage, we can get almost near total control. It unfortunately can affect even a newborn child or even a very old person. So it is our duty to spread awareness among the population, to know what is epilepsy, to understand the features of epilepsy, to guide them to go and get proper treatment at the earliest. Because there are a lot of medicines which work very well and which can help in controlling epilepsy. Why it is important for us to observe such kind of days is, it helps the common public to know that there is a disease called epilepsy, how dangerous it is, how easily it can be treated, and what will happen if you don't treat this case at the earliest. You as youngsters should know that epilepsy can occur in several ways. People can have a staring spell, or they can have a jerky movement, or they can have an eye movement, or they can suddenly become speechless. This is different kinds of disease. Whenever you find this kind of symptoms, it is important for you to educate your family members or friends or relatives that they have to seek treatment at the earliest. Simple tests like EEG, CT scan and MRI, which are available everywhere, are helpful to find out what kind of epilepsy it is, what medicine it might be needed, and for how long it will take. The chances of having effects of epilepsy is very less, because every time the child has got an epilepsy, several millions of cells in the brain die. They become dysfunctional. If the cells that are controlling speech are involved, they can have speech problem. If the cells that are involved for power of the limbs, they can have paralysis of the limbs. So it is very important for us to guide them to get proper diagnosis and proper treatment. So once the treatment is done, many of the people have got wrong information or misinformation that epilepsy is because of some spirit that has gone into the body. They will try and do some religious functions or religious kind of events which they think it might help them to get rid of it. You have to educate them that epilepsy has nothing to do with these spirits. If you take medications, you can control it. Next, many of the people have a wrong concept that alternative treatment is better than the allopathic kind of treatment, like taking some herbal treatment or giving some shock therapy. That's also not really advisable until we know what kind of it. Next, many of the people have wrong conception that some of the medicines which they take for epilepsy can cause more complications than cure. You have to educate them that also is false. The reason why we have to have things like World Purple Day or an awareness day is that all these misconceptions common man has got, we have to educate them so that in the world we'll have less number of epilepsy patients, less number of disabled people, and more number of people who can lead a normal life. Because you must have seen many of the people, especially women, when they have epilepsy, they're scared to go out. They're scared to go out and do shopping, scared to go to any functions because they don't know when the epilepsy can come. We have to educate them they can also live a normal life like all of us.